Okay, so good afternoon, everybody. My name is Colby Long, and my present partners are John Barber, Sierra Stiltner, and Lauren Clarke. Today, we're going to talk about ACL ruptures. Today, I want to talk about the introduction for ACL ruptures, but first, we're going to go into what the ACL is, and let's get a better understanding about how and why it's important for us to have the ACL. The first thing is, what you might ask is, what is an ACL? The ACL stands for anterior cruciate ligament. Why is the ACL important? Well, the ACL is important because of the amount of stability it helps with your knee. That is the only part that it helps and works. It keeps the lower part of your leg from sliding in a forward direction. Most importantly, it keeps your knee shifting. It keeps your knee from shifting side to side when you're moving. What I mean by moving, just from everyday, movements of life, that might be walking, that might be walking up some steps, sitting down. And from an athletic standpoint, I mean, all of your locomotor skills like skipping, hopping, running, jogging, bouncing, shifting side to side, planting and cutting. That's what keeps your knee stable. That way the bottom part of your knee doesn't just fall away from the top part. The next thing we're going to go into is how you can injure your ACL. Commonly, this happens in sports. I mean, I'm not saying it only happens in sports, but a majority it does happen in sports, and we'll get into that in just a second. This is more of a definition from a football standpoint. The way I can explain it is how you can tear your ACL is when your knee is planted in the ground and a sudden force hits your knee, causing a tear. An example of that would be, say someone is a running back, for example, would be running the ball and he gets stood up by somebody and another player comes in and accidentally hits that knee that's planted, and all that force generates into that knee. Well, all that force has to go somewhere. It doesn't just stay. It doesn't just disappear. So your ACL will only take up so much of it until it'll break. It'll tear. So the next thing is where the ACL is located. As you can tell, right here is your whole knee, and this is the front part of your knee because right there is but there's your what is that? Anyway, I'm sorry, I'm a little rushed on. But right here is the ACL. As you can tell, it's inside of the knee. So this is the top part, and then there's this little bitty, I'll call it a cubby, where your ACL and your PMCL is. And right here is the bottom part of your knee that it connects, and it helps join together and keeps it stable. As you can tell, you can see where it has the ability to keep it stable right there. And then I thought this picture was a good one to put in here as well. It shows how a partial tear will look. As you can tell, it's not a complete tear because there's still some together. Honestly, if from an injury standpoint, from an athlete standpoint, you would rather have a complete tear than to have this partially tear, just that little bit hanging on. Most time they'll just tear it all the way and then repair it that way. So, some stats on the ACL with tears. The majority of ACL tears happen between the ages of 15 through 45. All the way up to 45 seems shocking, but if you really think about it, most 45-year-olds are still active. They're walking, they're doing other things. They're not just sitting around like the older population. Especially 15 to 22. That's when a lot of your kids are still active. They're playing sports, and that's when you're most likely to tear it is in sports. Knee injuries account for 60% of high school sports surgeries, and 50% of that 60% is ACL tears. That's a pretty big number if you really think about it. Another shocking stat on ACL tears is there are from 100,000 to 200,000 ACL tears each year. That's kind of an incredible number. I mean, it's more common than what you would actually may think. And we keep going. So here is a diagram of a percentage of how certain sports have ACL injuries. Girls soccer surprisingly leads the category, barely, and then football is right after them. If you There's something that you can notice about this chart is that most of the higher number of ACL tears are in sports that are what you're more likely to do hard cuts in, and you're moving and you're shifting your body and you're making these really precise cuts instead of, say, for example, cheerleading. You don't really cut it that much in cheerleading, and you don't really cut that much. And baseball is all the way down here, boys baseball. If you really think about it, you don't really cut that often in boys baseball. Most time, like if you run the bases, you're rounding off bases. The only time you're going to cut is, say, like a ground ball comes your way, or when you're fielding the ball. Another thing you can notice is that girls sports lead most of the category in ACL tears, and we'll get into that later. One that did shock me was boys wrestling has more than girls field hockey. I thought that was pretty interesting. Little fact. So, as I said in the slide before, it's in most sports that ACLs happen in is a sport that you have to be able to cut on a dime and do really precise cuts and to move and get around the field and stuff. The next thing I'm going to talk about is non-contact tears. Non-contact tears happens when a person generates a lot of force in the knee, which puts an excessive load on the ACL. When I mean an excessive load on the ACL, your ACL can take up to 500 pounds of force before it will begin to tear. And I mean, that can happen to anybody, but what I mean by that is it could be all the way up to 500 pounds for some people. It could be less than 500 pounds for some people. And I'll get into that in just a second with an example with my sister. Another interesting thing about non-contact tears is 70% of ACL tears are from non-contact situations. So we'll go back to this chart. Girls soccer, it's not really a contact sport. Basketball is not really a contact sport. I mean, it can get a little physical, but I mean, compared to football, it's not really a contact sport. Gymnastics, lacrosse, I mean, boys lacrosse it can be, there can be some contact, but still there's not really as much contact as there are of avoiding and making these sharp cuts and things like that. So what I was talking about with my sister with the ACL that could take up 500 pounds of force, I've experienced a lot of ACL tears throughout my life. Just between my dad, I've never had one, but just between my dad and my sister, I mean, there's been 6 ACL tears. 6 knee injuries. One of them an ACL tear. My sister tore her MCL too. But my sister, she tore her ACL every year in basketball in high school, and every one of them come from it's a non-contact tear. Every one of them that it happened. The one that was the most odd was the one where we were at a summer camp. It was our sophomore year, and she stole the ball and it was going up for a layup, and she automatically just fell to the ground. And her freshman year, she tore her left knee, and the second year, she ended up tearing her right. And come to find out that my sister had a rare case where her ACL in her right knee was a third of the size that it was supposed to be, which for me, that was kind of cool. It's like, well, that's something that a lot of people can't say. But for my sister, she struggled with her ACL a lot. Because of that, they ended up having to take a ligament out of her hamstring, I think, and put in there. So that goes with the ACL. It varies on the person for 500 pounds to even could be less, which that pretty much wraps up all I have today. And the next thing is mechanisms and causes of ACL ruptures by Lauren. So thank you, and you have a good day.
Okay, so I'm going to be talking about mechanism and causes of ACL ruptures. So first, I just want to differentiate the difference between a mechanism and cause, because I think in this situation, they're a little bit different and it's important to state. So mechanism of injury, as described in my athletic training textbook, is defined as the mechanical description of the cause of an injury and or disease. In this situation, I think cause of injury would be more described like a risk factor. So, something that makes an individual more susceptible to having a certain injury or disease. So, let's say I'm talking about a rolled ankle, for example, and I would say that the mechanism of injury of the rolled ankle was inversion and plantar flexion of the ankle joint, which caused injury to the ligament. Now, maybe I would say that one of the causes of that ankle injury would be CAI, which is chronic ankle instability, and maybe that's because of a previous ankle sprain. So as you can see from that example, there's kind of a slight difference, but it's important to note as we go ahead and talk about or talk about ACL ruptures. So what is the mechanism of injury for an ACL rupture? So basically there's no one exact cause. Research has revealed that the mechanism of injury is multifactorial, which basically just means that it's a combination of several things. So we have non-modifiable factors, which are things that just cannot be changed by anybody or yourself, whether that be anatomical, genetic, or hormonal issues. Then we have modifiable factors, which are things that can be changed either through physical therapy, strength and conditioning, injury prevention programs, things like that. So we have faulty lower extremity biomechanics, which I will talk about a lot later on. We have a lack of muscular strength in the quadriceps and hamstrings. And then we have a lack of injury prevention training, which is just maybe a strength and conditioning coach or a head coach is not placing a lot of emphasis on proper form or bracing the lower extremity and spine, something like that. So as talked about in the introduction, we have non-contact versus contact injuries. And so I'm going to talk about these a little bit separately because their mechanism of injuries are a little different. So for non-contact injuries, mechanism of injury is an uncontrolled lower extremity biomechanics when an athlete is in a plant and cut motion. So this motion can be from deaccelerated from running, so you're slowing down, or maybe you're a basketball athlete, you're a volleyball athlete, you jump up and then you land incorrectly, which puts your body in that position. So when you're in this position, you're going to plant your foot, which causes that leg to be weight bearing, and it creates an upward axial force. So when you go to change direction to cut, this applies a valgus force to the knee on that same leg. Valgus is a medially directed force, so it's going to put the knee in abduction. So with the valgus and axial force combined, this creates an anterior shear force, and it causes the tibia to internally rotate on the femur. The tibia can internally rotate and externally rotate. It really just depends on what position your ankle is in, whether it's in eversion or neutral. But in this instance, I'm going to talk about internal rotation. So all of these factors combined make the ACL taut, and then you apply a large amount of strain to the ligament trying to cut, and this can cause the ACL to partially tear or completely rupture. So in this picture, I'm just going to move this down here. In this picture, I've just put a couple cutting positions that athletes might use. So this top one, this is going to be probably your track athletes, your runners, probably not in that exact position, but something similar. And the second one, possibly your football players. This third one is definitely going to be your male and female basketball players. Running down the court, you have to plant, cut, turn around in a completely different position and run back down the other way. And then again, this one up here, this could be your basketball athletes, possibly your softball or baseball athletes. They have to plant on the base, run to the next place, stop again, plant again. While these are all a little bit different from each other, they all share one common thing. As you can see in the third picture in the first one, second picture in these two, second picture in this one, they all have to plant to make that change in direction. And I think it's important to notice too, that sometimes that change in direction is at a 90-degree angle, which that type of change in direction is very, very hard on the ACL. So when I'm talking about that plant and cut position, I'm going to move this down here again. So in athletic training, we call this position a position of no return just because of how detrimental it can be to your lower extremity and to your ACL. So as you can see in the picture, we have hip adduction and we have femoral internal rotation and adduction. Again, in the picture, you see this dynamic valgus force, how it's a medially directed force, causes the knee to go into abduction. In this picture, the ankle is in eversion, but the tibia can again be internally or externally rotated. Usually it's internally rotated, but again, that just depends. But I mean, if you can see this position, if you imagine that ACL in the middle right there, the ACL is trying to prevent the femur from being posteriorly translated, and it's trying to prevent the tibia from being anterior postlated. And so if you over rotate that, you can see how much stress that could put on the ligament. So again, I can sit here and describe to you what it looks like all day, but I put this short 30-second video in there just so you can see what actually happens to the ligament during a rupture.
Tears of the anterior cruciate ligament are most commonly caused by having the upper leg displaced backwards or sideways by impact, while the lower leg is in a stable position, or by pivoting and jumping. This animation illustrates a complete tear of the ligament. As a crucial stabilizing ligament, a torn anterior cruciate ligament can cause severe knee instability and may also require reconstructive surgery.
So again, you just seeing the over rotation where it completely tore, translated. I just thought that would be helpful so you can envision in your mind what it actually looks like, because sometimes it's hard to picture. So now we're moving on to direct contact injuries. So again, the mechanism of injury is similar to non-contact injuries. The athlete is decelerating and changing positions. However, there is a small difference. Instead of starting in that position of no return, as we talked about in non-contact injuries, these athletes are hit in the knee, either from a lateral or posterior direction from another player, and that forces the knee into abduction, which creates that internally rotated position of no return. So again, this top picture, you can see that posterior force from the other athlete's leg, and you can see that the knee has been forced into obvious abduction. And then again, this tackle right here is about to force the knee into abduction. So again, in my athletic training clinicals, I've actually seen a non-contact ACL tear and I've seen a direct contact ACL tear. Both basketball players, non-contact. We had a female basketball player, went up to shoot the game-winning shot. Nobody was around her. She jumped up, shot the shot, missed. And when she came back down, she collapsed on the ground, ran out to her, and she said she heard a pop, which we know is a staple sign for an ACL tear. And all that happened was that she was rushing, she decelerated, went up to jump, and when she came back down, she landed wrong and put her knee in abduction. Direct contact, I had a male basketball player. He was a multi-sport athlete, previously a lineman, and he was also a post player in the basketball team. He went up to grab a rebound. Another player hit him from behind, so a posterior direction in the knee. He fell, and we weren't really sure because he didn't really have any staple signs, but he had, the knee abduction. The mechanism of injury was there. And a couple days later, found out it was a complete ACL tear. It's hard to picture a non-contact injury unless you've seen it, but, even though they're different, involve different things, the mechanism of injury is still very similar. Okay, so then my last slide is just a proposed cause. That's actually a lot of research is being done about this now. It's just quadricep and hamstring muscle imbalance. And I thought it was important to note. So your hamstrings and your quadriceps, they work together to allow you to bend your knee and to slow down. So your hamstrings have to contract your knee flexors in order to balance the contraction of your quadriceps that compress your knee joint. So a lot of people struggle with hamstring strength. A lot of people know how to strength train your quads, but you don't have that same strength in your hamstrings. If you don't have that same strength in your hamstrings, they are not going to be able to counteract and balance the contraction of your quadriceps. If you have an isolated quadriceps contraction, it can produce a force and compress the knee joint so much that is beyond the maximum stress of the ACL, which can contribute to an ACL rupture. So let's say that, you have a muscle imbalance. This could possibly predispose you to a full-blown ACL rupture, which is one of the causes and risk factors I talked about at the very beginning. And then my last slide is just my references.
Hi, my name is Sierra, and I'm going to talk today about ACL injuries in females versus males. Okay, ACL injuries in females versus males. So on average, there's about 100 to 200,000 high school athletes a year who are injured with an ACL injury. Although it's mostly female who end up with the injury, they're actually 2 to 6 times to have a greater risk of actually having that ACL injury. They're at that greater risk. On average, female have account for 20 to 80,000 of those injuries. So that's just a really good number to keep in mind. Females are 5 times more likely to sustain non-contact ACL injury. So meaning sports like swimming, track, cross country, softball, like those kinds of things. So you're 5 times more likely if you're a female to have that ACL injury, unlike if you were a male, you wouldn't have that greater risk. Although there's not one specific reason as to why females are more likely to have an ACL surgery, researchers like to believe there are anatomical and biomechanical differences between men and women, and that's what accounts for the injuries. I'm going to go a little bit more in depth about the physical factors and the technical factors as to why females are more likely to have that ACL injury as to men. Although with women's sports, as we've seen an increase in women's sports, we have also seen a greater risk of orthopedic injury. And that's another thing to keep in mind if you're a female and you are playing sports and you're using your knees a lot with your sport, with your running and or if you're jumping, you're going to see a greater risk of having an orthopedic injury from it. And one of those injuries being ACL injuries. And females with this, they have contributed to an overall epidemic in ACL injuries. So that's kind of something to keep in mind. It's not something I'd really thought of before I started doing this presentation, but I've actually learned a lot about it just reading into it. So we're going to go on to the next slide. So physical factors include smaller intercondylar notch in ACL, a wider pelvis, and lax ligaments. That smaller intercondylar notch in ACL, it is the groove in the femur where the ACL passes. The ACL is smaller to accommodate the narrow passage, so automatically that creates a greater risk for females. A wider pelvis causes a downward angle of the thigh bones to be sharper, which means when women bend their knees, they're going to be bending them towards the midline of their body, which adds additional stress to the ACL. I actually didn't know that before, but it does make sense having that wider pelvis and having the thighs more in. Then when you bend, you will see it, you will notice it. Lax ligaments, or better known as elastic ligaments, it does give you greater flexibility, but with that greater flexibility, you see more ACL prone. You're going to be seeing that ACL more prone to being stretched and twisted. So with that flexibility, yes, it's awesome, it's great, don't get me wrong, but you're going to be stretching the ACL more than what it should be, and you're going to be seeing it twisted more than what it should be. So those are some things to keep in mind, like when you're working out or when you're in sports, just in general. Just because of the way you're built as a female, you're automatically set up to have more ACL injuries. Technical factors include being flat-footed, having flat-footed landings, running upright, and quad dominance. With the flat-footed landings, you're going to see women tend to land on the soles of their feet instead of on the balls of their feet. And by landing flat-footed, the knee has to absorb most of the shock from the land instead of it being the balls of your foot where you're landing straight on your soles. The knees are automatically going to be catching all that absorption. So that's something to keep in mind whenever you're going down. Instead of landing on the sole, try to land on the ball of your foot and try to bend those knees so where they're not upright and absorbing all that shock and impact immediately. Running upright, I actually didn't know this was a technical factor until I started reading about it. But it actually gives you less control over your knee when it rotates. And with this, you're not going to have as good of control as what you would like during a sudden movement. So like a jab step in basketball, automatically, you're down for the count with that one, especially with your ACL, because those sharp movements can get you. And you really don't think about that, but it is a great factor. And like my mom, she was a basketball player and she did a jab step wrong and she tore her ACL. So it's definitely something to keep in mind when you're an athlete, because you want to make sure that you're doing all that you can to prevent having that ACL ruptured, and trying to avoid that surgery and the treatment and the physical therapy after. I mean, you're obviously always trying to do what you can to prevent that injury. But just changing the few things that I've talked about already, it's amazing what it can do. So then we go into quad dominance, and women tend to have stronger quads than what they do hamstrings, unlike males who have built up their hamstrings and their quads. Women tend to have the stronger quads. And what this means is we rely more on our quads for our movement. And with that, the knee's going to be compensating for the lack of hamstring strength by placing more stress on that ACL ligament. And that's important to remember when you're a female, when you're weightlifting or trying to build up that quad. Yes, build up the quad by all means, but also make sure that you're building up that hamstring and allowing more stretches for that hamstring. So that's always important to remember. And there's my references, and I hope y'all were able to learn a lot. I'm going to hand it over to John, let him go into treatment and conclusion.
So to wrap up this presentation, we're going to talk about treatment for ACL injuries and just a short wrap up of everything we've talked about so far. So let's get started. So treatment options. So when you have an ACL tear, you have one of two options, as you do with most injuries. The first is operative treatment or surgery, and non-operative treatment, or just heading straight into rehabilitation and strengthening what has been lost. So surgery is usually dependent on the level of rupture and future anticipated activity. So what that means is the level of rupture is if the damage is very severe or you have more than one structure damaged in the knee, such as your MCL or LCL or meniscus. But if one or more of those is injured in addition to the ACL being ruptured, surgery is your best option and should be expected. And future anticipated activity, so what this means is if you wish to return to sports in a semi-timely manner, or if you're a younger person whose body can heal well from a very intensive surgery like that. So this surgery is also an outpatient surgery. You do not have to stay at the hospital for surgery, and you're usually in and out and up and walking again by the day of your surgery. So it's recommended that you start moving as soon as possible so you can avoid scar tissue and actively restore that range of motion in the knee that has been lost due to the surgery. So ACL surgery has come a long way. It used to be they had to open up your whole knee and dig through and reattach the ACL, or perform a graft where they tear or pull another tendon or muscle and replace it with the ACL. But now ACL surgery generally just consists of a couple small incisions throughout the knee. It is an arthroscopic surgery, and it's generally left with little scars or minimal scars, and they send you on your way. So non-operative treatment, this is another word for conservative treatment or rehabilitation. So from non-operative treatment, you will just bypass surgery completely and aim to rest and rehabilitate the muscles around the knee, such as like the quads or the hamstrings, and regain control of the muscle. So what this means is like neuromuscular control, like being able to perform specific movements and ranges of motion. So we're going to talk about both of these moving forward. So first, we're going to talk about surgery. So for surgery, there's a handful of things that you can expect. So the damaged ligament will be removed and replaced. This is called a graft. So they will take out the ACL and replace it with another tendon from somewhere else in the body. This can be from any number of places, and if you have to have multiple ACL surgeries, or meaning that the ACL is repeatedly damaged, they will take it from more than one place in an attempt to strengthen the area. So so like I said earlier, ACL surgery is recommended if you're an athlete and you want to continue in your sport. This is especially true for sports that involve jumping or cutting and pivoting, so turning around on one foot. If, again, like I said, if more than one ligament is injured, or if the meniscus requires repair, and if you're younger, a younger person that could heal better from surgery and have, a full life ahead of you of using your knees. So, and finally, another criteria of surgery is if your ACL injury causes you to have trouble with daily activities. So if you have trouble getting out of bed in the morning and your knees buckle or fall over, and you just have trouble doing general activities, getting up, walking around, squatting to pick something up, or things of that nature, then ACL surgery is recommended. So after you get a graft, this will follow with a knee brace or splint, probably accompanied by some crutches, and they will recommend that you start moving as quickly as possible to avoid the buildup of scar tissue and to establish that range of motion and neuromuscular control throughout the knee joint. So also, over-the-counter medications, you'll likely be prescribed a painkiller, and you can grab over-the-counter medicines such as anti-inflammatories or antibiotics to help reduce swelling and just limit some of the swelling in the knee, and that will allow you to regain your range of motion. And then rehabilitation is similar, almost identical to conservative treatment, but it is just following your surgery. So we'll cover that moving forward. So conservative treatment or rehabilitation is the primary goal immediately after your injury is restoring homeostasis and range of motion to the knee. So what this means is restoring the muscle strength, restoring the range of motion, restoring to get mostly back to what you had before an ACL injury. So, and then range of motion is incredibly important as well. So, the most important aspect of conservative treatment is neuromuscular training. So, this is meant to improve knee stability. So, not only are your muscles and tendons and ligaments back at mostly full strength, but also regaining control of them so that you can use them in your day-to-day activities. So to advance with neuromuscular training, you must have full range of motion throughout the knee, full resolution of swelling. So what this means is there's absolutely no swelling in the knee, because all swelling serves to do, while it is a sign of healing, initially, it'll just limit your range of motion otherwise. And then finally is sufficient lower limb strength. So what this means is mostly quad and hamstrings, and then your lower leg muscles back to mostly full strength. And not necessarily full strength, but sufficient strength to be able to perform the activities that you want to perform. What will happen after your conservative treatment is if you are an athlete or want to return to some semi-serious activity, you will have to go through extensive functional performance testing, and you can pretty much count on having to wear a brace for these activities for the rest of your life. An ACL injury is no joke, and in order to prevent further injury or re-injury, you will likely wear a brace. And after this, if surgery or conservative treatment, if you're lucky to return to your sport, you will have to be very diligent and careful to not perform the same motions that you performed that got it injured in the first place, and more than likely it will still not feel the same, and it'll change your knee for the rest of your life, hopefully with no pain. So moving on, just conclusion of what we've already covered so far. So we've covered just the general anatomy of the knee, the muscles, ligaments, tendons, and the articulations. We have mechanisms of injury. This is especially important because an ACL injury is a non-contact injury for the most part. And it's important to understand how to avoid those motions or those mechanisms of injury. And then finally, we've covered the prevalence of ACL injuries in females versus males. This is just an interesting and slightly concerning area of study regarding this injury. And any kind of awareness that we can bring to the subject is good awareness. So, and then finally, I have my references, and that is it.